All right, thank you so much for joining us for this month's meeting of CTeL's AI Working Group. We've got three major developments from the past month that I wanted to go over. First being some discussion coming out of the White House about the potential for another slate of actions surrounding AI regulation. And then the lawsuit coming out of Pennsylvania against Character.ai. And then finally, a brief highlight of an RFI from the FDA concerning AI as well. So first, over the past few weeks, there's been some reporting that the White House is considering options to address specifically oversight of new and more powerful AI models. There is growing concern within the White House about the potential um, for these models and the need for increased oversight of them. However, how the White House is actually planning to do so um, has not yet been decided. The initial reporting said that the White House was considering an executive order that would require the federal government to vet new models in a similar way. The reports described it as similar to an FDA style, where new models would need to be vetted and approved by the government. There's also been, after the initial reporting, the White House walked back a little bit and said that they're exploring more of a partnership model instead of a direct regulation. And then over the past week, there's also been some reporting from Axios that there's been a pretty big letter sent to the Trump administration, including signatories from folks like Steve Bannon, urging the White House to take more stronger action when it comes to vetting and regulating the release of new AI models. And so there hasn't been any specific action or regulatory action coming out of the White House just yet. But there is now been a few weeks of reporting that the White House is considering, um, is weighing its options and consulting with its allies on what specific action it should take to address this issue. This also comes as I was earlier today reading a report about Anthropic's new model, I believe Mythos. And there's a new report about some cybersecurity concerns, specifically in healthcare, and their ability to exploit zero-day vulnerabilities. And so this is something that has yet to be fully taken action on from the White House, but it is something that is currently being discussed. Any questions here?
So the letter you said the letter that was sent, like from including Steve Bannon signatures, they are recommending federal government have more oversight.
Yeah, they are recommending and pushing the White House to consider that more stronger vetting and approval um, model rather than a softer partnership model as others in the White House are considering instead of regulation.
Okay, thank you. Does CTEL have a stand? Or
We haven't taken a specific stand on, are you asking specifically about the issue of like new models and vetting of them?
yeah, like who, oversight where,
Yeah, I think our general position is more oversight, more wanting more oversight, transparency surrounding abilities and potential exploits and risks, and a better understanding of what potential patient safety risks may be posed. And so we do tend to lean more towards the oversight and transparency side of things, whereas the administration has continued to take the position that it's trying to do everything it can to reduce regulation and try to promote as much AI development and proliferation as possible.
thank you.
But again, the White House is also starting to contend with some of these other issues, like the safety issues, major sign-ons from the this letter to Trump also include conservative organizations that are concerned about job displacement, for example, and some of those issues as well. And so the White House is trying to kind of balance those two needs as it's considering these actions. I think the other big story from this month, as I'm sure I've seen a lot of discussion on this, is Pennsylvania's lawsuit against Character.ai. Character.ai is a chatbot company that creates AI chatbots and characters for people to interact with. And the state government is suing the company, saying that it is violating the state's Medical Practice Act by posing as a licensed clinician and offering medical advice when it was not authorized to do so. In the press release, the state government said that in one instance, a chatbot falsely stated it was licensed in Pennsylvania and provided an invalid license number. This is something that a lot of especially given the increased interest from companies like OpenAI and ChatGPT, and others to develop specifically medical focused models both for patients and clinicians. This is something that's been getting a lot of attention and will likely have an influence as to how these companies continue to develop and roll out these models, and whether or not they continue targeting them towards healthcare services specifically. In a statement to the press, Character.ai said that user-created characters are fictional and intended for entertainment and role-playing, and that the company has taken robust steps to make sure that clear, including prominent disclaimers in every chat to remind users that a character is not a real person and that everything a character says should be treated as fiction. And so CTEL will continue to monitor this lawsuit as it plays out, given that an increasing number of Americans are turning to AI chatbots for either direct medical advice or for navigating healthcare as well. This is something that will likely have an influence as to how these companies continue to roll out their models to consumers.
Lydia, I have a question. On the I'm not as familiar with character AI, although I did hear about this case. Was this a case of a layperson just asking a medical question of the character? Or is there a subsection that's meant to give layperson information regarding medical care?
It looks like whereas like previous lawsuits were about like a specific incident of like harm, whether a patient like was like directly harmed or killed because of their interactions with the chatbot. It looks like this is more just saying that the state was prodding these characters and they were able to get it to claim to be a licensed
So
professional.
they deliberately elicited by using prompt questions.
That's what it looks
Okay,
rather than a specific um, like a family bringing a suit against the
right.
company
Okay.
for a specific instance of harm.
Hmm. Interesting.
Any other questions or comments on this issue? This is something we'll continue to monitor and provide any updates, especially as it affects the use of AI in clinical practice more broadly. And finally, the last update that I wanted to highlight is a request for information coming out of the FDA, looking for information to solicit input on a proposed pilot program to assess how AI-enabled technologies can improve efficiency, speed, and quality of decision-making in early phase clinical trials. I wanted to bring this up because while it is AI focused, I did also want to highlight that there's been a lot of turnover, specifically in the FDA as well as HHS more broadly. As you may have seen last week, the FDA Director Marty McCary stepped down after his firing was greenlit by the White House the week prior. Um, he had become increasingly embattled, and his firing was recommended ultimately by Secretary Kennedy. Um, this now means that a number of agencies, like the CDC and NIH, don't have confirmed leadership at the top. And given that there's also been a massive wave of layoffs as well as rehirings in later months, especially earlier this year, there's been increasingly lower coordination within the agencies, which is also affecting how both these rulemakings come out and how the FDA is implementing a lot of its programs. We'll also be watching to see how these leadership changes affect how FDA implements its rapid payment pathway, for example, um, and how it will continue to approve these devices and attempt to improve its coordination with agencies like CMS. Any questions here? So those were the three main updates that I wanted to highlight from the past month. Are there any other questions or comments that we didn't get to address today yet that we wanted to talk about? If not, then I just wanted to highlight a couple upcoming events that CTEL is putting on over the coming month. The first being a webinar about femtech and queer digital health, specifically focused on market opportunities and growth strategies. This will be June 8th at 2 p.m. And then later in the month, CTEL will be hosting a roundtable in person in New York City, focusing on digital health markets and how laws and policies impact a lot of the business decisions facing digital health leaders. Registration for both of these is available on the CTEL website.
Is there any chance that may be virtual?
Um, for the June 25th New
Yeah,
York event,
yes, sorry.
I'd have to double check, but I believe we've been directed to make this a in-person only event.
Okay, thank you.
And so that's all that I have for today. If you have any questions, you're always welcome to reach out or set up some time to call with me at any time. I hope you all have a great rest of your day.
And happy Memorial Day weekend, Lydia.
Yes.
It'll be cooler by then for sure.
Yeah,
Take
thank
it
you.
easy. Bye. Hey, Joe.